Go.
Hey Tim, thanks so much for taking the time to meet with me this morning. I really appreciate what you told me about your business and your current occupational health care provider. Before I go on any further, Tim, you mentioned a couple things that I just want to clarify with you. You had mentioned that with your current provider, oftentimes it's hard for you to get paperwork back, and more specifically drug screen results. And you mentioned that a lack of receiving those results in a timely manner can really affect your business, especially when you're doing a lot of time-sensitive hiring. Did I understand you correctly with that?
That is a concern for the group.
Great. Tim, there was one other thing here that I took note of, and that was your concern about the physicians who are treating your employees once they're injured on the job. And you had mentioned that you're just not sure that they understand the way an injured employee can affect your business. Is that still a concern of yours, or did I understand you correctly?
Absolutely. That's the major frustration with our organization.
Okay. All right, Tim, well, I'm sorry to hear that. Unfortunately, your concerns are very common, actually, in the industry, and I hear that similar concerns from a lot of my clients. And quite frankly, Tim, Concentra as a whole heard a lot of those same concerns throughout our clients across the country. And so recently it caused us to take a step back, Tim, and try to determine what great looks like in terms of a best-in-class occupational health care program. And Tim, we weren't sure that we knew. So what we wanted to do was do a bunch of research. And so we started internally with our current clients. And what we did, Tim, is we hosted customer forums where we invited our current clients to come in and tell us what they liked about Concentra, more importantly, what they didn't like, and what they would like to see out of a best-in-class occupational health care program. So we gathered a lot of great data that way, but we really wanted to balance that feedback, and so we reached out to the experts in the healthcare field, which were the American Medical Association and the American College of Occupational and Environmental Medicine. It was then determined that there were 10 components that make up a best-in-class occupational health care program. And Tim, you had mentioned a couple issues that you had, and those both popped up here on this list. You had mentioned how important it was for you to get paperwork back in a timely manner. Well, that would fall under structured and managed communication process, because with an effective communication process, you're going to get those reports in a timely manner. One other thing you mentioned here, Tim, was that you weren't really convinced that the physicians treating your injured employees really knew about your business and how it affected yours. Well, one component in a best-in-class occupational health care program is building physician relationships. So, we took these 10 must-haves, Tim, and then as an organization, we really retrenched our business. And we set out to make sure that these components were being delivered to every patient in every Concentra clinic across the country. And, it was a struggle. And really, in an effort to make sure that that was delivered in an effective manner, what Concentra did was we devised a delivery system called the 4 key elements. And so we determined there are 4 key elements in delivering a best-in-class occupational health care program. And Tim, the first one is employer engagement. And Tim, that's what I'm doing with you here right now, understanding what you need as an employer and making sure I work with you in a collaborative way to make sure your needs are met. Tim, the second one is patient engagement. We want to make sure that every patient that walks into our clinic is welcome and respected and has a positive experience in our clinics. The third one is clear communication, which we touched on a little bit, Tim, but it's making sure that you feel like you know what's going on with your patients when they're in our clinics. And then fourth is the quality medical outcomes, Tim, and that's really our treatment philosophy, which is early intervention, early return to work. And so, we had mentioned a little bit about having that physician relationship, and to take that one step further, I think with those physician relationships, it really can improve your quality medical outcomes. So, Tim, that's what Concentra has done to ensure that we are delivering a best-in-class occupational health care program.